So if you want to learn about what are the most important topics that's covered on the NCLEX exam, next generation NCLEX exam, then you're going to want to watch this video all the way from the front to the end, so that way you can totally understand what's covered on the exam. This is actually part 2. And if you're watching this video, hopefully you're watching this at the right time, because I did go live recently on Facebook where I went over part 1. And unfortunately, Facebook does delete the videos within 30 days, the live videos. So make sure you watch that before it gets taken down. So that video goes over the first 5 topics, and this video is going over the last 5 topics. And if you really want to prepare for your exam the right way and really be ready to take it and to pass, you can go ahead and comment the word guide right now in the comments. And what we'll do is that we'll actually email you, we'll actually send you my free next generation ebook. This is a 70-page ebook that you can download immediately, so you can be able to learn what's on the test, what you need to know so you can pass in detailed strategies, questions, etc. So comment the word guide if you want to get access to that today, right now. All right, so let's go right into it. And if you watch this on YouTube, hello from YouTube. Don't leave the comment guide, because we won't be able to reply to you directly that way. Instead, review the description, check the description below, and you can get access to it that way. Okay, so let's go over the other 5 things that you need to know that's covered on the NCLEX, so that way you can pass this exam, slam it, get your license, and move on. So then number 6, all right, number 5, the next topic is going to be lab values. Lab values. So a lot of times when people study labs, they study only a portion of it, where they don't realize this. So meaning that, like, they'll study what is normal versus what's abnormal, right? So you need to know not just only like what's the normal range, but you need to understand what does it mean if it's low, and what does it mean if it's high, and what's the interventions for both cases, right? So it's not only where you just know, the normal range, but beyond that. So let me give you an example of that right now. Let's talk about white blood cell count, WBC, right? So the normal standard for WBC is going to be 4 to 10. In fact, I think I'm going to leave that in the comments. 4 to 10, right? That's the normal white blood cell count. So now so most students, what they'll do, they'll just study what it is. So at minimum, they'll know what it is, and then they'll know what the normal range is, and that's not enough. You got to know more than that, right? So with WBC, white blood cell count, obviously it's something that we use to help to monitor infection, right? So if a patient's WBC count is greater than 10, then it often indicates infection. Either infection, most cases, or an increased inflammatory response in their body. Now, if you combine that increased white cell blood count, plus also a temperature, plus also change in level of consciousness, plus also increased heart rate, respirations, then your patient may actually be septic, right? So that would be a more severe case, and that's more life-threatening. And if we don't give the appropriate antibiotics, the patient won't survive, right? So that's the first thing, is that if it's greater than 10, it means usually that they have an infection or some sort of inflammatory response. So that's the minimum, right, of knowing what that means. Now, what do you do? So the normal response is 2 things. They need to usually get a combination of fluids, especially if they have low BP or they're not eating and drinking on their own, right? So they need to get a combination of fluids, and then the most important one is they need antibiotics. So a lot of times doctors will put them on a broad spectrum antibiotics, which may be like vancomycin or something, until the blood cultures come back and it reveals what they truly have, right? So that's usually oftentimes what happens. So remember that for greater than 10. Now, if it's less than 4, right? If it's less than 4, what does that mean, right? So if it's less than 4, then it means that the patient is immunocompromised, right? So, and there are some situations where patients could have, what do you call it? Low WBC count, and actually they're not immunocompromised. Very rare, happens sometimes though. So it usually means that they're immunocompromised, and you need to be more careful with them when it comes to infection, right? So these patients, they're more sick, and a lot of times this may be your patients that have like cancer. So because they're immunocompromised, you have to be very careful when it comes to hand washing and people coming in and out of the room, right? So there's a very specific procedure that we do, which is called neutropenic precautions, right? Neutropenic precautions. So when it's neutropenic precautions, then in that case, we're going to do the whole thing. So we're going to limit visitors. We're going to make sure that there's no fresh fruits or plants in the room, because that's going to also increase the risk for infection. And then we're also going to make sure that if the patient leaves the room, that they put on a mask when they leave the room, right? So these are some of the things that we would do. So understand what it means if it's low or high, and then what you would do, right? And so I just broke it down for you in both regards. Now, if you're tuning to this video, don't be a stranger, don't be shy. Go and comment below and let me know where you're watching from. Let me know exactly who you are, as far as, are you a nursing student? Are you a nursing grad? Are you already working as a nurse? Are you taking your LPN, your RN? Would love to hear from you. So that's the first thing, is the lab values. Number 2, the second thing is opioids. Opioids. So here's the thing. There is what you call a epidemic in the United States, right? There's what it's called the opioid crisis. And what essentially means is that a lot of people are on pain medication and are addicted to the pain medication, or there's a problem with pain management. So the reality is that many physicians hesitate towards prescribing narcotics, which are going to be like Vicodin, Norco, Percocet, things like that, morphine, right? Because although it's very effective for their pain, the issue though is that it is addictive. Patients will develop a tolerance, and it has life-threatening effects when used misappropriately or long-term, right? So you need to know, for the sake of the test, you need to understand that spectrum when it comes to opioids. You need to know what the side effects for opioids, and then what is tolerance, right, versus dependence. So tolerance pretty much means that, okay, maybe 1 week, the patient's there for back pain or something. The doctor prescribes them, Norco, right? So they start off with 1 tab of Norco, and then after a month or 2, now it's not doing anything. Like before it was effective, now it's not doing anything. And now they want 2 tabs per dose, right? So that's tolerance, where their body develops a tolerance to the medication. So you need to be familiar with those terms. You need to be familiar with the side effects. One of the biggest side effects is sedation. So you'll see oftentimes there's patients where like they're in the hospital, and you're giving them morphine every 4 hours, wherever they they need their medications on the dot, dilaudid every 2, 3, or whatever hours, and they will press the call light, and they're like this, literally like this, and then you come into the room, yes sir, or yes ma'am, what do you need? And they're like, I need my dilaudid, I need my morphine, I'm having pain. you know, and they're like, this is how they're like, you know, like they look like they're out of it. And you're just like, you know, pain is subjective, right? Pain is subjective when it comes to nursing. And you're like, okay, what's your pain level? And they tell you 10. It's always 10 out of 10. It's never 0 or it's never 2, 3, or 4. A lot of times it's like 10, you know. And so the problem that we have, especially in America, in the United States of America, is that people are taking pain meds. And there's not enough answers to the pain medications. There are not enough solutions. There's not enough understanding as far as why they're having pain and what to do about it. So people end up becoming addicted to other medications or other drugs, even illegal drugs, that helps to deal with their pain. Heroin, fentanyl, meth, right? And it helps with their pain. And so they have addiction problems. And then that obviously affects their life, right? So you need to be familiar with the opioid crisis and how it affects and what you would likely see if a patient is taking opioids regularly, all right? The next thing, number 3, is high-risk medications, high-risk drugs. Oh, if you're watching this, like I said, don't be shy. Go ahead and like this video. Like, if you're enjoying the content, like the video at least. Like the video, hit the follow or like button on the page, or subscribe on YouTube. And then also, we do have a challenge that's coming up. So with the challenge, that's a bigger experience. If you want to really supercharge your nursing career, comment the word challenge and we'll send you the link so you can register for free. So the third thing, like I said, is high-risk medications. You should be familiar with what are the high-risk drugs. What are they? And then what do we do to prevent them to prevent mortality? Like, what are the extra precautions that you take with high-risk drugs, right? So the one of them, right, and the one that is most commonly given is going to be insulin, right? Insulin is considered high risk. So that's why insulin, you can't just give insulin anyhow, right? You have to know what their blood sugar levels are, and you need to give it within a certain period of time, and you need to make sure that they eat, right? So that way their sugars don't drop dramatically, right? So that is an example of insulin. You need to know the difference between onset, peak, and duration, right? So you need to know the normal, so within each of the different types of insulin, within each of the Humulin R, Humalog, right, MPH, regular insulin, you need to be familiar with, okay, what's the onset for each of them? What's the peak for each of them? And what's the duration for each of them? Like, how long is the onset for Humalog versus regular insulin? How long is the peak for Humalog? How long is the duration, and etc., right? So being familiar with that, I'll give you and then the other thing too as well is you need to know, what do you do? What's the normal interventions per stage? So what do you do during onset, and what do you do during peak, and then finally, what do you do during duration, right? So let me give you a quick hint, right? A quick tip. During onset, obviously that's the time where you need to make sure the patient's eating. So the priority is eating, right? So that way their blood sugar doesn't drop. So whatever their sugar was, and then we give based on whatever the sliding scale says that we give, then within either that 15 or 30 minutes or 2 to 4 hours, depending on which insulin it is, you got to make sure that they're eating, right? So typically, inside of my courses and classes, I do go over all of them with my students. I go over, okay, what do we do during Humalog, Humulin, MPH, regular, Lantus, Levemir. I go over each of them, the onset, the peak, and the duration, and the interventions for all of them. And that's just one type of high-risk medication. Another high-risk medication is also heparin as well, right? So you have to understand why we're giving heparin and what are the concerns with giving heparin, especially if they're on a heparin drip. The fourth thing that you need to know that's on the test is labor complications. Labor complications. So this is not like the problems that occur during the pregnancy, such as placenta abruptio, but what the type of complications that occurs once they're actually in labor, right? Or that can occur. So one of them can be prolapse cord, right? So what are they? And then what are the signs and symptoms that occurs that indicate specifically that it's that complication? So for example, if it's prolapse cord, what happens, what's going on with the patient, or what's going on specifically with the baby actually, is that the umbilical cord has wrapped around the baby's neck. That's what's going on. And what you see in this situation is that the baby's heart rate drops dramatically and stays down. Unlike late decelerations, which is another type of complication, where it drops but then it goes back up again. That's different, all right? So with prolapse cord, it drops and it stays down until we relieve the problem. And sometimes the way that it can be treated, the textbook way is to, do C-section. But there's definitely been interventions where a nurse literally will go in and relieve the cord off the baby's neck, and the heart rate will go up, right? So because sometimes you don't have time, sometimes there's no time, right? So that's another one. That's labor complications. The fifth thing, number 5, you need to know is post-procedure complications. Post-procedure complications, all right? So a lot of times, this is the number 1 area that a lot of my students struggle with when it comes to post-procedure complications, because you have to, this is so critical, you have to know the difference between early signs and late signs. And then you need to prioritize the significance of one complication occurring with one type of problem versus another type of problem, right? So for example, here's 2 things. Here's the example, right? So if a patient has, let's say a patient just has surgery, this is a general question, surgery. And they had surgery, they come back from surgery. What is likely to occur within the first, let's say 12 hours, as opposed to 24 or 48 hours later? Within the first 12 hours or less, the biggest concern is going to be bleeding, right? Bleeding is number 1, so their blood pressure is going to be your biggest concern within those first 12 hours, right? That's why we check the blood pressures, the vitals so often. But 24, 48 hours or more later, then the biggest concern is infection. That now it's different, right? So that's an example where early versus late, it's not the same thing. And so a lot of students, when they're taking the test and they're doing practice questions, they struggle between the choices, with limiting the choices, because the question told you it was this time when they had the surgery, but you were focusing more on the fact that it's generalized to surgery, to complications in general, but you have to hone in on the timing, early versus late. Just like with a lot of complications, early versus late, just being aware of those things is so important, super critical, right, for you to know. And then also being aware of which complication is specific to the procedure, right? So all patients, you're concerned, all patients could have a risk for bleeding that come back from surgery. All patients, because it's surgery. They went in and did an incision. But a patient that, let's say, did like a cardiac cath, their concern is going to be more specific. So with that one, I'm going to be concerned about their pedal pulses being present on the right leg, because they went in and did surgery in the groin area, typically usually on the right side. So that's the biggest concern, specifically for cardiac cath. So that's one thing. is that when you look at the complications, you got to be more specific. You got to know not just, okay, bleeding, low blood pressure, or infection, but you got to pay attention to, okay, the difference between early versus late, and what complications specific to this type of surgery as opposed to this type of surgery. All right? I hope that was helpful. I hope that you learned something. If you learned something, please let me know. Comment below. Just tell me like, yes, this was helpful. Yes, I took something away, so I can know where you're at, if you're enjoying this. If you want to get the guide, comment the word guide below. If you want to join our challenge that's coming up, our 3-day nursing challenge, comment the word challenge, and we'll send you the link through the messenger so you can join the challenge. All right. Thank you for tuning in. Thank you for subscribing and following. If you want to be a part of our membership program, and this is the opportunity where you'll get access to teachings like these, but I also give you notes, slides. I also give you videos that you can go back, that you don't have to worry about deleting because Facebook deletes them, right? You have access to video tutorials. It's all organized, study plans, different things that you have access to, along with live private teachings that I have. Then comment the word membership, or check the description to join or to learn more about joining my membership to help you succeed. Thank you for tuning in. I'll see you the next time. Take care.